Where can you find comprehensive medical services, expert clinicians, newly renovated spaces, and a breathtaking view all in one location? Only at the Des Moines University Clinic. Call today or visit dmu.edu/clinic.
Hey everybody, my name is Katie Harbeck and I am a first-year DO student with the DMU Geriatrics Club. First, I just wanted to say how thrilled I am that so many of you are tuning in at home to join us for the 50 and Better Virtual Health Fair. Today I will be discussing how to take care of your eyes and preserve your vision for many years to come. Before we get started, I would like to give you an overview of what we'll be going over today. First, I will be talking about some common eye disorders, most of which you have probably heard of before, but may want to know more about. Then I will be discussing some healthy habits that you can implement in your day-to-day life to keep your eyes healthy. Last, we will be talking about some common visual complaints and when they might be a sign of something more serious. The first eye disorder that I'd like to go over is cataracts. Most of us have probably heard the term before, so what exactly is a cataract? A cataract is a normal, age-related clouding of the lens. When we are all born, this lens is clear and helps to focus light coming into the eye and create a clear image that the back of the eye can then send to the brain. Just as we all will develop gray hair at some point in our lives, if we live long enough, this lens will become cloudy over time, creating a cataract. In fact, most people have had cataracts or cataract surgery by the age of 80. Cataract surgery takes out the cloudy lens and replaces it with an implantable clear lens in its place. Cataract surgery is generally a very safe procedure and is one of the most common procedures in the US. So how will you know when it's time to have surgery? Some symptoms of progressing cataracts are cloudy or blurry vision. Some will describe this as looking through wax paper. Colors may look faded, and some may seem halos and glare around lights, while others may have difficulty reading road signs from far away. Cataracts may also cause your prescription to change more frequently, and although updating your glasses and contact prescription may help to improve your vision, they can only improve the refractive error and won't help with symptoms like clouding, glares, and halos. If you think you are experiencing some of the symptoms of cataract changes, an ophthalmologist can help you determine if you are a candidate for cataract surgery. The next eye disorder we will be talking about is glaucoma. Glaucoma is a group of eye diseases that cause a problem with the drainage of fluid in the eye, causing a buildup of pressure. Glaucoma can best be described with a bathtub analogy. So if you have a bathtub like the one in this picture here, there are two ways that it can overflow. Either the faucet is on too high or the drain may be clogged. Similarly with glaucoma, either the inside of the eye is producing too much fluid, or the area of the eye that drains this fluid becomes blocked. In both situations, fluid builds up inside the eye and can increase the pressure within the eye itself. This increase of pressure can over time damage the cable that carries information from the back of the eye to the brain that we call the optic nerve. Glaucoma is one of the leading causes of blindness in people over 60 and is what we call the theft of sight, because it gradually damages the vision in your periphery. And most will not notice this damage until the disease has reached an advanced stage. Unfortunately, we do not yet have any way to fix the damage to the optic nerve, so vision loss due to glaucoma is permanent. The good news is, your eye care provider can monitor for glaucoma changes in many ways. Most common being a dilated exam, where your doctor can check the health of the nerve in the back of your eye. Your doctor can also take a special picture of the back of your eye that can measure the thickness of the optic nerve itself. Another common test is a visual field test. This tests how much of your peripheral vision you are able to see. So everybody over the age of 60 should be evaluated for glaucoma with a dilated exam. If you have a family history of glaucoma or other risk factors like long-term corticosteroid use such as prednisone, your doctor might want to follow you more carefully. Although glaucoma can seem scary, there are a lot of treatments available, the most common being eye drops. Surgery and minimally invasive in-office laser procedures can also be performed to improve the drainage system in the eye and are effective against glaucoma. Moving on to macular degeneration. Macular degeneration is a thinning of the light-sensitive tissue in the back of the eye called the retina. Macular degeneration specifically causes damage to the part of the retina responsible for central vision. Symptoms of macular degeneration include visual distortions and reduced central vision, which can in turn cause a difficulty in recognizing faces. At this time, there is no cure for macular degeneration, but special vitamins can slow the progression of this disease, and low vision resources can help those who are symptomatic improve their day-to-day life. Macular degeneration is more common in those over 50, and Caucasian individuals and people with a family history of macular degeneration are also at more risk. Other risk factors include smoking, obesity, and cardiovascular disease. If diagnosed with macular degeneration, your doctor may start you on vitamins that can protect your retina and may have you monitor your vision at home with an ampular grid. As shown below, those who have macular degeneration may see bends or distortions in the grid. The best way to protect your eyes against macular degeneration, especially if you have a family history, is to have regular checkups with your eye doctor. And if you smoke or use other tobacco products, asking your primary care physician to help you quit can be a great way to keep your eyes healthy. The last eye disease I will be talking about is diabetic retinopathy. Anyone with type 1 or type 2 diabetes is at risk for diabetic retinopathy. This risk is greater the longer blood sugar is uncontrolled. Higher blood sugar levels over time can cause damage to the blood vessels that supply the light-sensitive tissue in the back of the eye called the retina. These small blood vessels can experience clots and bulges that can leak fluid, called microaneurysms. Eventually, if enough blood vessels are damaged, new ones will start to grow that can cause additional problems. Symptoms of diabetic retinopathy include floaters, blurred vision, poor color vision, as well as dark or empty areas in the vision. In addition to improving blood sugar control, treatments for diabetic retinopathy include laser and injections, which both aim to target weak or abnormal blood vessels in the back of the eye. Now that we've talked about some common eye diseases and disorders, it's time to move on to talking about how to protect your eyes. In the next few slides, I will be going over some habits that you can start to help you keep your eyes healthy. Fortunately, many of the things that you can do to improve your overall health are ways that you can also protect and preserve the health of your eyes. This includes getting regular exercise and eating a healthy, balanced diet. A healthy, balanced diet should include a mix of fruits and vegetables, especially leafy green vegetables, as these have nutrients that can nourish your retina. It is also a good idea to reduce the amount of cholesterol in your diet and eat a moderate amount of healthy fats such as omega-3 fatty acids. Foods with omega-3 fatty acids include salmon, tuna, flax seeds, and walnuts. It is best to try and avoid fried and fast foods when possible, and limit your intake of processed meats like sausages, bacon, and hot dogs. In addition to diet and exercise, making an appointment with a primary care provider can help you monitor your overall health. For instance, your primary care provider will make sure that your blood pressure is in a safe range. Having high blood pressure can cause damage to the small blood vessels in your body, just like the ones in the back of your eye. If you are a diabetic, it is important to maintain good blood sugar control and have your hemoglobin A1C checked every few months. If you smoke or use tobacco products, asking your primary care provider for ways to help with cessation can be an excellent way to take charge of your overall health and can have added benefits to the health of your eyes. Moving on, we're going to talk a little bit about eyewear. You should wear sunglasses when outside. Sun exposure can damage your eyes and raise your risk of cataracts and age-related macular degeneration. Protect your eyes by using sunglasses that block out 99 to 100% of both UVA and UVB radiation. You should also wear protective eyewear in instances where things might be flying at your face or at your eyes. To prevent eye injuries, you need eye protection when playing certain sports, working in jobs such as factory work and construction, and doing repairs or projects around your home. While we are talking about ways to keep your eyes healthy, some of you may have questions about eye vitamins. At some point, all of us have probably walked down an aisle in the grocery store and seen shelves full of endless vitamins, like the picture the one at the bottom of the slide. This can certainly make it difficult and confusing when trying to decide what vitamins to take. You may have heard about special eye vitamins, like AREDS 2. AREDS stands for Advanced Eye Disease Studies, and it is a supplement that has been shown to help those with diseases like macular degeneration. These vitamins are often prescribed to those with macular degeneration, but may have little benefit to those without the condition. You may be wondering then, what vitamins should I take to protect my eye health? Vitamins can be a great way to supplement your nutrition if you're someone who can't stomach some of the foods we talked about earlier. However, you should always talk to your doctor first before starting new supplements and vitamins, as some vitamins may interfere with medications you may already be taking. Your doctor can also help you determine if you are nutrient deficient and if you need to be taking any supplements. Okay, we just spent the last few minutes discussing ways to keep your eyes healthy. So now, what should you do if you're experiencing some changes in your vision? It is always a good idea to discuss changes in your vision or eye comfort with your doctor. For instance, pain, redness, or a decrease in your vision are all concerns that should be addressed by your eye care provider. In the next few minutes, we will explore some common visual complaints and what steps you can take. Flashes and floaters are a common visual complaint that many older individuals will experience. Everyone's eye is filled with a thick, jelly-like substance called the vitreous. As we get older, this gel starts to clump and pull away from the back of the eye. As it does so, it may tug on that light-sensitive tissue called the retina, and this can cause you to see flashes. The clumping of the gel inside the eye can cause you to see what to some people looks like a fly in their vision. The process of your vitreous clumping and detaching from the back of your eye is a normal process, and your brain will adapt to the floaters over time, and you will notice them less. Although rare, sometimes when the gel pulls away from the back of the eye, it can tug too hard on the retina and cause a tear. Like wallpaper peeling off of a wall, this tear can become bigger and is a sight-threatening emergency. Symptoms of a retinal tear can look like a sudden increase in floaters, almost like you are looking from inside of a snow globe, lots of flashes like a paparazzi is taking pictures of you, or a curtaining in your vision, where part of your vision may seem dark or veiled. Fortunately, if caught soon enough, your doctor can perform surgery to reattach your retina to the back of your eye. Since symptoms of a vitreous detachment and a retinal tear are so similar, anytime you experience new flashes or floaters, it is a good idea to schedule an appointment with your eye care provider as soon as possible. They will be able to perform a dilated exam and determine the cause of your symptoms. The last thing I would like to talk to you all about today is dry eye disease. This is especially important as we are moving into the colder, drier months. We have all probably experienced symptoms of dry eye at some point in our life. This can include a dry, gritty, scratchy feeling, and although it sounds counterintuitive, frequent tearing may also be a sign that your eyes are dry. To understand why our eyes get dry, it helps to get a picture of the surface of our eye. The outer layer of our eye is protected by a coat of our tears called the tear film. As we age, this film may deteriorate for a number of reasons. Fortunately, there are a lot of effective at-home treatments for the symptoms of dry eye. A lot of us right now in our quarantine are spending more time on our screens and reading than we may have in the past. When we look at things up close for long periods of time, we tend to blink less. And blinking allows us to coat the surface of our eyes with a fresh tear film. One way we can improve the comfort of our eyes while reading and doing computer work is using the 20-20-20 rule. Or every 20 minutes you spend doing up-close work, you should look away and focus on something around 20 feet away from you for 20 seconds and remember to blink. Staying hydrated is another great way to keep your eyes healthy. It is recommended that you drink 8 to 10 glasses of water a day. Artificial tears can be found over the counter at the drugstore and basically act like lotion for the surface of your eyes. A few drops throughout the day can help lubricate your eyes. Just be sure to avoid drops that say "get the red out," as these may cause more damage to the surface of your eyes over time. During the cold winter months, when the air is drier, using a humidifier inside the home or office can be very helpful, especially if you work in places where vents may be blowing dry air in your face. Another great at-home remedy for dry eyes is warm compressing. You can use a warm washcloth or even warm eye compresses that you can buy over the counter at the drugstore. These can help warm up the oil glands in your eyelids and can improve the tear film that coats your eyes. If you are still bothered with symptoms of dry eye after trying these at-home remedies, your doctor may be able to perform in-office treatments to relieve some of your dry eye symptoms. Before we finish up, I would like to review some important take-home messages that we talked about today. You should always talk to your doctor about new or worsening visual concerns. It's a good idea to follow up with your primary care physician to monitor your overall physical health. And you should schedule an annual dilated exam with your eye doctor. For glaucoma patients specifically, you should always take eye drops as instructed. If you have difficulty taking drops or if they're too expensive, you should talk to your doctor, as they may be able to find a better solution. Thank you so much for tuning into our presentation on eye health. I hope you enjoy the rest of the virtual 50 and Better Health Fair and that you have a wonderful rest of your day. If you would like additional information on what I talked about in this presentation, I have included a page here of my references for your convenience.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.